Good morning, Dr. Anjanappa TH, surgical gastroenterologist, former professor of surgery at KIMS Bangalore. I am practicing at Mamata Nursing Home, Rajajinagar, and Dr. Anjanappa Daycare Center, Rajajinagar. The address you can get on Google, 17th Cross, Mamata Nursing Home, Rajajinagar. And today all of you know World Hepatitis Day. This is for the information of a common man. Your liver is situated in your abdomen on the right side. It weighs about 1500 grams in males, about 1400 grams in females. Unfortunately, if the liver gets infected, we call it as hepatitis. Like tonsillitis and appendicitis, this organ can also get inflamed. That is called hepatitis. There is a specific reason for inflammation. Means it gets infected by a virus. The commonest virus that infects the liver is hepatitis A, B, C and E. Out of these, hepatitis A is less dangerous, but B and C and E are more dangerous. In future, if they develop hepatitis B or C, they may develop cancer of the liver at a later date. And they suffer from hepatitis, and for all the symptoms of hepatitis are you feel feverish, you get tired, you will have nausea, vomiting, loss of appetite, that is don't feel like eating any fried food. These are all some of the symptoms, and jaundice is most of the time it is commonly seen in hepatitis. But there are a lot of medication available. I don't tell you any brand name, but only thing you must consult your family doctor and a gastroenterologist for your further treatment. There are definitely specific treatment, and for prevention definitely there is a vaccine. As a prophylactic you can take a vaccine. And how do you get these infection? Most of the time it is from contaminated water and food. It is hepatitis A, it is foodborne. Unfortunately, B and C, it is blood-borne. If you take injection from a contaminated needle, syringe, or particularly drug addicts, they use common syringe, common needle. And those who get blood transfusion, if the blood is not properly checked in a blood bank, and sometimes unfortunately the surgeons, they may get this infection from a patient if they get injury, that is needle injury or knife injury. These are all some of the things commonly the common cause for this hepatitis A. Why it is important? Because nearly world statistics says 4.5 million people they die prematurely because of hepatitis. That's why we are trying to create this awareness among the common people. Be careful. That is one thing. And if there is a treatment, kindly, it is a constant habit in our country. They go for local medications. We call it as naughty medicine in Canada. And kindly avoid all these things. Go to a specialist. And particularly there are since specific drugs and specific advices for you to prevent this infection we advise. So naturally I have to tell you what are the things you should do, what are the things you should not do. First thing, what are the things you should not do is, suppose if somebody is positive in your hostel or at your home, kindly avoid using these cloths, these other instruments, other utensils, kindly avoid. Second thing, be careful whenever you take an injection from a unqualified doctor. Quacks, we call them as quacks. They may not use disposable syringes. Be careful. And whenever you get a blood transfusion, you must be aware that it should be from a good blood bank, a standard blood bank where they do all these tests, then only transfuse. And what are the do's? To take care of your liver, you have to use more sugar, and particularly sugarcane juice we advise. And liver is protected by food. Kindly avoid alcohol. This is another important. Smoking and alcohol, they are supposed to damage your liver. Kindly avoid them. And some of the painkillers, particularly paracetamols, and once in a way if you use for your fever or headache, doesn't matter, but constantly don't use painkillers. And there are definitely specific liver protecting drugs and be aware of it. If you come to me, I know what drug to prescribe for you. So since there are many names, I will not repeat these brand names, but definitely I can assure you there are a lot of good companies, they manufacture good drugs that I will be able to tell you. And always, particular to avoid hepatitis A, don't use contaminated water, boiled and cooled water, and roadside eating kindly avoid. Most of the time, hepatitis A you get from those who eat on roadside, these pani puri and all those things where food is stale, you may get that. And this is very important. And as a complication, when you are in hepatic failure, we call it as liver goes to failure, you should be in the hospital. And if you can afford, definitely there is a liver transplant surgery is available, but it is expensive. But I should educate you that there is a specific medical line of treatment and surgical line of treatment. So all these things are very, very important. So finally, let me conclude by warning you not to take alcohol and smoking. That's very, very important. And this is one of the common infections. Particularly, it is more common in if you go to slum areas, and that is unhygienic areas. And particularly drug peddlers and alcoholics and drug addicts, they suffer from this particular disease. So kindly take care of your liver. Once the liver shrinks, we call it as cirrhosis of liver. You develop cirrhosis, at the same time you will develop portal hypertension, and finally you will vomit blood and you will die like our hero in Devdas movie. So let me warn you by telling you, be aware of this. That's why this day is dedicated for hepatitis, because we can create awareness among you. So particularly this is, we have seen less common in women, but much more common. One more I should warn you, if you are hepatitis A or B or C positive, this can be transmitted by sexual contact also. That's why we have warned the partners, kindly use barriers like condom and other things is one of the method of and unsafe sex. You are supposed to get this from professional sex workers if you don't take care of yourself. So this is a very important warning to all the people. So finally, unsafe sex, alcohol, smoking should be prohibited as far as possible, and you must go for a allopathic system. Though I am not against any other system, but you may be misled unscientifically by other systems. But I am being an allopath and being a gastroenterologist, I will assure you there is wonderful drugs are there to protect your liver. When you come to me personally, I will let you know what medications can save your liver. Thank you.